The Hondius docked Monday, so the outer edge of that 42-day incubation window lands in early July, and the surveillance clock that matters has just started.
This is Hantavirus Watch. The ship is done sailing, the contacts are spread across multiple countries, and now we've got a peer-reviewed NEJM paper showing person-to-person transmission. So yeah, the question of whether this response was built for the wrong exposure model is no longer hypothetical.
We're talking Andes, the 42-day deadline, that midstream CDC quarantine reversal in Nebraska, and what the 2018-2019 Chubut superspreader cluster actually tells us versus how it's getting rewritten today.
Right, and I want to know which countries can still catch somebody who gets sick on day 38, because that gap is fixed now.
From Maria Popescu at CNN.
The diagnosis of a strain of the Andes strain of Hantavirus, an infection that's fatal in about 40% of cases, on a ship carrying people from roughly 24 countries, has given public health officials around the globe their first major test in controlling contagion since the COVID-19 pandemic.
The MV Hondius docked Monday, so that's the date the clock really starts. Count from there, and the outer edge of the 42-day incubation window lands in early July, which means the surveillance period that matters is just beginning, not ending.
And the CDC already changed course once. Passengers were sent home under a looser monitoring setup. Then the agency reversed itself and brought them into a Nebraska federal facility after new positives came in from France, Spain, and Canada. So when I've been asking whether zero confirmed just meant zero tested, well, the CDC answered that by tightening the rules midstream.
The CDC is keeping U.S. passengers at that Nebraska facility through May 31st, which they're calling the 21-day mark. That's the short end of the monitoring range. Andes Hantavirus has documented incubation out to 42 days. So May 31st is a checkpoint, not a clearance.
And that's the U.S. What about the 24 other countries where passengers scattered as soon as the ship docked? CNN says plainly that countries are handling this differently. Which ones are holding people for 42 days, and which ones cut them loose at 21? Because somebody getting sick on day 38 under the looser rule is not a near miss. That's a miss.
This one's from Clinical Trials Arena.
According to Disease Outbreak News, which was published by the World Health Organization, WHO, on 13 May, there have been 11 total cases of hantavirus originating from the cruise ship Hondius, 8 of which have been confirmed to be the Andes strain, ANDV. There have also been 3 deaths, yielding a fatality rate of 27%.
Clinical Trials Arena is drawing on the WHO disease outbreak notice from May 13th. So the numbers it's using are 11 total cases, 8 confirmed Andes strain, 3 deaths, and a 27% fatality rate. That's the same WHO document we've been anchoring to all week. None of today's secondary coverage changes those figures.
But here's what that piece does that the official notices don't. It treats the ship's closed environment as an active transmission amplifier, not just a coincidence. Shared food, shared water, everybody breathing recycled air for days. And now the Hondius has docked. The voyage is over, so the operator can't hide behind developing situation anymore. What is the actual guidance for people with future departures booked through Ushuaia?
The closed environment angle lines up with the NEJM Chubut cluster paper. 34 confirmed cases, 11 deaths, and 3 identifiable superspreaders driving transmission at crowded social events. That's peer-reviewed evidence that Andes spreads under exactly the kind of conditions a cruise ship can recreate. The Mirage news rewrite that's circulating today is secondary. The NEJM paper is the source you need to name.
And if public health authorities built the Hondius contact tracing response around rodent-to-human exposure, trace back to the port, find the nest, done. The NEJM paper was already out when they made that call. Somebody decided the person-to-person literature didn't change the protocol. The passengers now sitting in a federal facility in Nebraska are living inside that decision.
Hans Steiner writing in All Talk.
Coverage of a Hantavirus exposure incident involving Americans connected to a cruise ship describes a shift towards strict quarantine rules in the United States. The CDC said people being monitored after exposure to the virus were not allowed to leave a Nebraska facility, even after earlier guidance had suggested isolation at home might be possible.
The MV Hondius docked Monday, which puts a date on the outer edge of the 42-day incubation ceiling, early July. And the Nebraska story is where this week's open question about monitored versus tested actually lands. The CDC reversed course midstream and pulled people from home isolation into a federal facility after additional passengers tested positive.
So people were told, you can isolate at home, got on planes or into cars, and then CDC came back and said, actually, Nebraska facility, you're not leaving. That's not a protocol refinement. That's the original assumption failing in real time. I want to know who made the home isolation call first, and whether the people already released under the looser guidance are being tracked down.
What makes this sourceable instead of speculative is the NEJM to boot cluster paper. 34 confirmed cases, 11 deaths, and 3 identifiable superspreaders driving transmission at crowded social events was already in the peer-reviewed record. If the original quarantine architecture was built around rodent-to-human exposure only, that's a documented mismatch with published science, not a guess made in the dark.
And now the Hondius has docked. The 42-day clock is running from Monday, and the outer edge of that window lands in early July. While the original source of the Ushuaia exposure still hasn't been named, the reservoir is unconfirmed, the response protocol has already been revised once, and we're asking contacts in multiple countries with different rules to self-report for the next 6 weeks. That's the situation.
Here's New England Journal of Medicine.
After a single introduction of ANDV from a rodent reservoir into the human population, transmission was driven by 3 symptomatic persons who attended crowded social events. After 18 cases were confirmed, public health officials enforced isolation of persons with confirmed cases and self-quarantine of possible contacts. These measures most likely curtailed further spread.
The NEJM paper is getting a second wave of coverage today. So let's be precise about the source. This is a peer-reviewed study in the New England Journal of Medicine, Chubut Province, Argentina, 2018 to 2019. 34 confirmed cases, 11 deaths, and 3 identifiable individuals driving spread by attending crowded social events after a single rodent-to-human introduction. That's what the study documents. The rewrites circulating today have the same numbers, but the framing is looser than the original.
3 people at crowded social gatherings. That's the mechanism the Chubut response had to catch, and they did catch it, but only after 18 confirmed cases triggered mandatory isolation. So my question for every health authority managing Hondius contacts right now, was your contact tracing architecture built for rodent-to-human exposure only, or did anyone actually read this paper before handing out home quarantine guidance?
That's a fair escalation, and the Nebraska CDC story gives it teeth. The agency moved from home monitoring to mandatory facility quarantine midstream after additional passengers tested positive. So the original framework clearly changed under pressure. The Chubut paper was already in the literature before any of those decisions were made.
And now the Hondius has docked. The 42-day clock is running from Monday, and the outer edge of that window lands in early July. While the original source of the Ushuaia exposure still hasn't been named, the reservoir is unconfirmed. The response protocol has already been revised once, and we're counting on contacts in multiple countries with different rules to self-report for the next 6 weeks. That's where we are.
Mirage News writes,
in April 2026, a passenger boarded a Dutch cruise ship in Ushuaia, Argentina after a birdwatching trip. 10 days later, he died. The cause of his death, while initially unclear, was determined to be Hondius Hantavirus, ANDV, which he picked up prior to boarding the ship. His wife, sickened by the same virus, later died as well. As of this writing, there have been 10 reported cases of ANDV infection from the ship, resulting in 3 deaths.
The Mirage News piece on Andy's human-to-human transmission is now everywhere. So let's be exact about where the underlying science actually lives. The 34-case, 11-death Chubut cluster, with 3 identified superspreaders driving spread at crowded social events, is documented in a peer-reviewed NEJM paper. Mirage News is the rewrite. The NEJM is the source.
And here's the problem with that rewrite taking off right now. The Hondius response we've tracked all week was built around rodent to human exposure. 1 passenger, a bird-watching trip, contaminated environment. But the NEJM paper and this Mirage explainer are both in the public record saying Andes can spread person to person under close contact conditions. Has any public health authority actually acknowledged that pathway in the way they designed the contact tracing for this ship?
Not in anything we've seen sourced from WHO, CDC, or ECDC this week. The WHO disease outbreak notice from May 13th is still the primary document in circulation, and the CDC Nebraska quarantine story is the closest thing we have to an implicit acknowledgement that the original framework was insufficient, because they tightened it midstream after additional passengers tested positive, following the home quarantine guidance.
So the NEJM paper was already published. The Chubut cluster had already shown person-to-person spread at crowded social gatherings, and the initial call was still home isolation. The ship has docked. The 42-day window is running from Monday. Who owned that decision, and are the people released under the weaker protocol being called back?
If Hantavirus Watch helps you stay informed, take a moment to subscribe and leave a review wherever you're listening. It's a small thing that helps other people find the show. You'll find links to every story we covered today in the show notes, along with the source material if you want to take a closer look. Follow up on anything that caught your ear. That's Hantavirus Watch for this Friday, May 22nd. This is a Lantern podcast.